This video's aim is to help if you are suffering with Piriformis Syndrome. What is it? The piriformis muscle, located in the buttock region, spasms and causes buttock pain. The piriformis muscle can also irritate the nearby sciatic nerve and cause pain, numbness and tingling along the back of the leg and to the foot. Anatomy: small muscle located deep in the buttock behind the gluteus maximus. Symptoms: pain in buttock and sometimes down the back of the leg, sometimes pins and needles or numbness down the back of the leg. Also, painful to sit on that buttock, pain walking up and down the stairs, stiffness in the hip or back. Causes: muscle spasm in the piriformis muscle, either because of irritation in the piriformis muscle itself or irritation of nearby structures such as the sacroiliac joint or the lower back or the hip. Tightening or swelling of the muscle in response to injury or spasm, either within the area or close by. Bleeding in the area of the piriformis muscle, and common in people who sit for long periods. Diagnosis: Piriformis syndrome can be diagnosed by a physiotherapist, and there is usually no need for further testing, although the underlying reason for it may need investigating. If you are unsure of your diagnosis, then consult your GP or physiotherapist, as the wrong exercises for the wrong condition can make you worse. Exercises are able to help your symptoms. The flexibility exercises should be pushed into discomfort while performing them, which should generally make you feel better and looser afterwards. The strengthening exercises should be pain-free or should not increase your pain during or after. If you get worsening symptoms or are unsure, then initially reduce the push into discomfort, and if this isn't enough, then stop altogether and consult your physiotherapist. Flexibility exercises. The first exercise is single knee hugging. Lying on your back, bring one knee up toward your chest, grab your knee and pull it so you feel a stretch. Hold for 20 seconds, now swap and repeat with the opposite leg. Next, bilateral knee hugging. Lying on your back, bring both of your knees up towards your chest, grab your knees and pull them so you feel a stretch. Hold for 20 seconds. Next, extensions in line. Lying on your front in a press-up position, use your arms to push up so that your lower back arches and your pelvis remains on the ground. Go as far as is comfortable and hold for 20 seconds, then slowly lower back down. The next exercise is hip flexion, adduction, abductions. Lying on your back, bring one knee up towards your chest, grab your knee and pull it till you feel a stretch. Next, roll your knee from one side to the other. Continue this movement for 20 seconds. Now swap and repeat with the opposite leg. The next exercise is hip external rotation. Lying on your back, bring your knee up towards your right shoulder with your right hand on your knee. Maintaining this position, take hold of your right ankle with your left hand and pull it round towards your head. Hold for 30 seconds. Now swap and repeat with the left leg. The next exercise is hip internal rotations. This one is a less aggressive stretch, and there are also other ways of stretching this movement. Lie face down and bend both of your knees at right angles. Allow your feet to move apart using gravity to gain a stretch. Hold for 30 seconds. Hamstring stretch. Lie on your back, lift your right leg up off the ground, keeping your knee straight. Now reach and hold your leg with both hands and pull it up as far as you can while maintaining a straight knee. Hold for 30 seconds, then repeat with the left leg if needed. If you can't reach with your hands, use a towel and loop it behind your leg. Piriformis Stretch. Lying on your back, bring your right knee up toward your left shoulder with your right hand on your knee. Maintaining this position, take hold of your right ankle with your left hand and pull it round towards your head. Hold for 20 seconds. Now swap and repeat with the left leg. Strengthening exercises. Glute strengthening, the Clam. Lying on your side, feet together, knees and hips bent and knees together. Slowly lift your top knee off the bottom one as far as you can, but being careful not to roll your body at all, then lower down. Repeat 15 times or till fatigue, then change and do the other leg. The next exercise is bridging. Lying on your back, put your feet flat on the floor with your knees bent to 90 degrees. Lift your bottom off the ground till straight and lower back down. Hold at the top for 5 seconds and repeat 5 times or till fatigue. The next exercise is knee pivots. Lying on your side, feet together, knees and hips bent and knees together. Slowly lift your top leg off the bottom one. Now the aim is to keep the knee of your upper leg in the same spot in the air, so that you pivot around it. Next, lift your heel up towards the ceiling. Now lower the heel down as far as you can, maintaining the same knee placement in the air and without rolling back in your body. Repeat 15 times or till fatigue on this side, then swap and repeat for the opposite leg. The next exercise is heel pivots. Lying on your side, feet together, knees and hips bent and knees together, slowly lift your top leg off the bottom one. Now the aim is to keep the heel of your upper leg in the same spot in the air so that you pivot around it. Next, lift your knee up towards the ceiling without rolling back with your body. Now lower the knee down as far as you can, maintaining the same heel placement in the air. Repeat 15 times or till fatigue on this side, then swap and repeat for the opposite leg. All of these exercises need to be done at least 3 times a day, ideally little and often. It takes a few weeks to increase flexibility and several months to increase strength, so give it time and persevere.